Hi guys, what's up? Welcome back to my channel, and if you are new here, welcome. So today is the day. I have tried to film this video twice already and it just did not happen the way I wanted it to happen, but we're filming it today and I'm so excited because today's video I'm going to be going over my second semester of nursing school, how that went, how it ended, everything that happened. I'm going to be breaking this video down into like 3 separate categories, basically like my program, like the classes and stuff, and then like everything that's happened, and then like what's next. So this is going to be a pretty fun video to record. I'm looking forward to sharing with you guys my my second semester, and I cannot believe I am making this video. I'm kind of like in awe because I'm halfway done. I'm halfway done. So without further ado, I'm not going to keep this intro too long. Let's go ahead and get in this video and let's go over second semester of nursing school. So if I'm looking down, that's because I'm looking at my notes, because I had to like write stuff down so that I can stay on track. But anywho, all right, so I'm gonna first start off with like my program, how my program works, if there's any new people viewing this video, if there's any new followers or subscribers or however you word it. I'm still kind of getting used to having to word it politically correctly. I don't know. So I attend my local community college. They offer a 2-year RN degree, and here it's the Associates of Science in Nursing. And like I said, it's a 2-year degree. You have 4 semesters in total. We sit for the same NCLEX, so the university that's in my town as well. I do plan to attend there to obtain my BSN pretty soon after I graduate. I plan on attending there to get my BSN, but we sit for the same NCLEX that they do. So it's just they have their bachelors and I'll have my associates. They pick our classes for us. We do not choose our classes. How they break it down is you have a fundamental semester, that's the fundamentals, and you take just fundamentals of nursing, and then if you pass, you get on to the second semester. If you don't pass, you have to reapply. It's an intense program, but it's fun once you get past those hurdles. It's really fun. We got a lot of fun. But yeah, so like I said, we do not pick our classes. We do not sit down with an advisor and pick our classes. Our classes are picked for us. And I don't know about your guys' programs, but my program, they cut it down and they separate med-surg and pharmacology into 3 semesters. And then the 3rd class you have with each one is like a specialty class. So that's pretty much how my program works. And then I am on target to graduate spring 2023, and we'll be taking the next gen NCLEX, which is going to be interesting, but we're getting prepared for it. I think we're getting prepared for it at least. All right, so for my second semester, the classes I took were Med-Surg 1, Pharm 1, and Mental Health. Med-Surg 1 was an amazing introductory course. We started off Med-Surg 1 where we ended fundamentals in, and that was like oxygenation and acid and fluid based imbalances, electrolyte imbalances. So we hit the ground running in Med-Surg 1 with learning how to read certain lab values and where it would place you, whether it was hypervolemia or hypovolemia. And then you have hypernatremia, hyponatremia, like hypo, all of the electrolytes. And then you have the acid-base imbalances. So are you acidosis or alkalosis? Are you respiratory metabolic? And then you have to learn all the values and all the stuff like that. So we hit the ground running in Med-Surg 1. Like it was difficult, but it was so worth it because you get to learn different, like all of the stuff you need to know when you're looking at like lab values and you're going over patient's information and stuff like that. So it was fun, but it was so difficult because I thought fundamentals, it was difficult. That was nothing. It wasn't even like a piece of anything. Like it was literally, it wasn't even I don't even know what it was, but it wasn't what we needed for Med-Surg. It was like I had to go back and learn fundamentals. It was just too much, y'all, too much. So we hit the ball running in Med-Surg 1, and it was difficult to latch on, but over time we latched on and we got to kind of make ourselves familiar with information and stuff like that. We learned about cardiovascular things, we learned about vascular diseases, peripheral vascular diseases. We also learned about and like skin issues and disorders we'll be coming across like that, and those are just like small tidbits. I hadn't even went over everything else we went over. It was a really good introductory course into what we're going to be seeing, into med-surg nursing all around, and it was a really good introductory course. Pharm 1 was kind of the same. We learned about medications, and we learned about like the basic medications, right? Who can have it, who can't have it. We learned about NSAIDs, we learned about salicylates, we learned about antihypertensive medications, we learned about blood glucose medications, we learned about arthritis medications. We learned about a lot in Pharm 1, and apparently there's even more to learn because I have two other classes in pharmacology. So, but it was a lot of fun to know the dosages, and also like reversals, because I honestly didn't even know like a lot of stuff had reversals to it. I also didn't know like you couldn't, you can't have an NSAID with an antihypertensive, or I guess it's kind of one of those, like you can't have certain medications with other medications because they'll have counteracting things and they can cause a domino effect in your whole entire body. So it was really fun. It was a lot of fun. And then I also had mental health, and for mental health, we learned about therapeutic communication. That's one thing I thought I was a people person until I took mental health. Like I didn't realize that there was so much that goes into talking to patients, because if you say one thing wrong, it can send them off the edge, or it can help them on the right path. If you maybe say something too soon, they didn't have time to reflect on what they said and to go deeper into how they're feeling so that you can assess them the correct way, get them to the right thing that they need, the diagnosis that you have, whatever, yada yada. So it's like mental health was actually like Pharm 1, Med-Surg 1, yeah, they were a little difficult, but mental health to me was the most difficult because I would sit there and I overthink already. I overthink everything already. So now here I am sitting here taking a test, and I'm like, well, that word seems like that would do this, and then, well, this is kind of giving off this kind of tone. Maybe I should go with this one. Well, this one's over here. It may lead them into thinking that they can't trust you, and da 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 da. You know what I mean? And some of the answers are like stone cold, like, ew, who would say that? But other ones you're like, well, could this get more information you need, or would this make them pull back? So there, I thought I knew how to talk to people. Apparently I do not know how to talk to people. I still did well in the class, but it messed with me because I was like, now that I know like how intricate mental health is and how sensitive and how fragile is the word I'm really looking for, fragile mental health it can be, especially when people are in their most vulnerable state. It's kind of like, you got to be careful with that. So that's something that I'm going to work on going forward, really, since I'm going to school to be a nurse for the rest of my being. I got to work on therapeutic communication skills. I got to work on how to properly not vet a patient, but at the same time know the right way to speak to a patient when I'm assessing them or something like that. So this semester, those are the classes I've taken, and I did well in all of them. I made B's in all my classes, so it is so hard to hit that threshold to get to an A, but whatever, I passed this. That's it. That's all I cared about. For mental health clinical, we went to our local psych hospital. We got to see the different wards. We got to see, the different populations they had. We got to see different age groups. It was a really good overall experience dealing with that. I got to talk to a lot of nurses, ask them questions on why they chose to go into psychiatric nursing and why they, chose to work here over blah, 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 what they did, because a lot of them seem to come over from like working in the hospital to going into this smaller facility. So, it was really cool to learn all these information in, all these different viewpoints, all these different perspectives, learning, getting down level to level with patients who are in there. Because I feel like a lot of times people, at least for me, when I first walked in there, I was thinking, oh my gosh, I can't talk, I can't speak, I can't do anything. That's the furthest from the truth. Talk to these people like that, because they regular people, you know what I mean? So, and you get to the core of like how they feel and stuff like that. And sometimes you can make a difference, you know, you never know. You could always make a difference in someone's life. You never know how words can affect that person. So mental health was a lot of fun. Is that nursing style for me? No. And I'm glad I got to experience it. But it is not something that I want to pursue myself. But it's all, I want to keep my mind open, my options open. It's no, you know, it's nothing I'll write off completely, but it's something that I'm not necessarily itching to go into, if you catch my drift. So, but it was a lot of fun to experience that and all that. So, mental health overall, I made a B in that class. It was very difficult, but eventually I got a good foot landing, I guess that's the right wording, and understanding how to test, how to study, you know, stuff like that. So, all right, so for med-surg. Okay, so for med-surg, we had our clinicals in the hospital. And so we went to different floors. I was on an orthopedic floor one day. I was down in the ED one day. I went to step down. And then I got my specialty day and I went up to ICU. Now, ICU is where I want to go. That is where I feel like I will thrive. And that was before I even got to experience it. Now that I experienced it, that's all I want to do. Like, that's it. I don't want to do nothing else. Don't want to feel nothing else. Don't even want to smell another floor. Like, which I'll get into that later because I work on a cardiac floor, but ICU is where my heart is. Like ICU, I have to have it. I have to have it when I graduate. But anywho, so I got to experience ICU one day and it was so much fun. It was the most fun I think I've had like since starting nursing school. So first you have 2 patients per nurse, right? So you have 2 patients. My first patient that I had to go in, first of all, I love getting report because it was juicy, y'all. And I shouldn't even say that because these are patients, these are people, these are real life scenarios. But it was like, whoa, you know, that was whoa, really? So then first patient got extubated, they got sent out. And then my second patient, he was still intubated and he had so much stuff going on, but I got to see everything on this one patient. I got to feed him through his Dobhoff tube. I got to give him medications through his central line. I got to care for his, and most people think this is gross, but I don't care. I got to care for his colostomy bag. I got to care for his JP drains. I got to care for all kinds of stuff. I got to do an assessment on him, and I got to see his reflexes and how he responded to pain. And I just got to be able to see, you know, I got to assess him and to see, and I just think, and the whole time I was there, I just felt like it was my calling because they're in such a vulnerable state when they're in the ICU. Like they either had something traumatic happen, or they're coming from a surgery, or you know, something like that, and they're just in a very critical, vulnerable state. And you know, while I was there, I didn't notice any visitors, and not to say like he didn't have any visitors, because I mean it's COVID, you know. But I just felt like the whole time I was there, like I was meant to be there. Like I just wanted to stay with him, stay focused. And it was just like, cause they're in such a vulnerable state. Like, you know, they can't do anything. They can't walk, they can't talk, they can't move. Just the biggest thing is I just felt like I was making a difference. And even though that patient probably won't remember me, won't whatever, I remember them. I remember that patient. It was a really, really, really good feeling inside. It makes my heart flutter even now talking about it, and I've talked about it long enough. But ICU's for me, and I got to experience that. and it was a lot of fun. And then the last couple days of clinicals, we were up on like a med surg floor, which was not, I mean, it was fine. I mean, and sometimes I do like that fast pacedness where you're dealing with multiple patients. You just see different things, you see multiple things. But where I work over at the hospital, I didn't have trouble jumping in, helping with changing patients, you know, pulling patients up, repositioning, yada, yada, yada. But ICU was definitely as you can tell, was my favorite day to go. So that's all about classes and clinicals that follow. And the clinicals were a lot of fun. Clinicals were a lot of fun. As you could tell, I enjoyed that a lot more than I did mental health. So pretty much the semester, you know, we had lots of fun times, and we had, you know, some lower times. This is where I'm gonna get a little preachy, you know, and I'm gonna get a little preachy. This past semester was difficult because one, you're moving from one class to 3. Clinicals, you have 2 clinicals, and yeah, they're separated, but it's a lot during that week to try to find time to study, because these are 12-hour clinicals. So if you're in class in lab on Monday from 8 to 4:30, then you have class Tuesday, you have class, you have clinical Wednesday, you have class Thursday, and then you either have class on Friday or you work on Friday. But for me, I had lab on Monday, class Tuesday. I was out Wednesday, but I started working, so I work every other Wednesday. Thursday I had class, and then Friday were my clinicals. So I really had Wednesday, Friday evening, Saturday, Sunday to study. And when you have exams every week, you have homework due pretty much every week, every day almost. Golly. You have homework, you have quizzes, you have papers, you just have so much to do. I think that's the biggest thing with dealing with the increase in class load, because that not only you're going from one class with all that stuff already, so now you have 3 classes with all that stuff already. And we didn't have clinicals with pharmacology, but we had homework due. We had these VSIMs, because VSIMs, they're, you know, if you guys are in their school, you know what I'm talking about. You have they're basically virtual simulations with dealing with the patient case, da 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 da. And you had to make certain percentages on those, certain points on those, and da 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 da. And some of them VSIMs y'all could take forever. Like, I don't even want to tell you about the one I got with the diabetic patient. Oh my gosh, I killed my patient twice before I figured out what to do. And the first time was a total accident. I didn't even realize it. He was over here going limp, so I just called the code. Wasn't even supposed to do that. Then the second time I got a little bit better, and then I panicked, and then I called the code again, and I killed him twice. But that third time I finally figured out what the heck to do. But anywho, make a long story short, you have a lot of stuff you have to do, and on top of that you have to study because you got to do well on your test. So I think that's the biggest thing for me this past semester and it was so difficult to try to get through because I also have children. So it's already difficult on its own. So then you have real life situations popping in on top of the responsibilities you have, and it can get really, 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 really intense and stressful. So this past semester I talked to my doctor and I got on something because I was having really bad anxiety, and I don't really pull the mental health card like that, you know. Not to say that it's something, and I'm not trying to say that it's something that you pull when it fits your narrative or it's something to be ashamed of, but you know, mental health is a very serious matter, right? So you have to tread lightly when you speak about it, talk about it, refer to it, or whatever. And I felt like I was dangling, y'all. I felt like I was dangling. I was losing it. I was always angry. My kids, sweet as pie, but Lord, they were itching that bear. And typically, you know, because as a mom, sometimes you got to handle it. Sometimes you got to pick your battles. But man, when I tell you I was not responding well, I'll put it that way. And I'm always crying, I'm always stressed, it was just too much. So I went and spoke to my doctor, and you know, it was something that I needed because it was important to me that I could not stay in control, because you don't have control over everything, but more so to stay on the path. Like I didn't want to really tweak out to the point where like felt like I could go forward, or I had to give up, or I had to sit out, blah, blah, blah. So I went and got on something this past semester because it was just really stressful. It was very, very stressful, and it was important for me to finish, and it was important for me to still be a mom, and it was important for me to not go into these deep, lonely, depressive episodes, and then I don't talk to my friends, and then I'm starting to overthink my relationships with my friends and stuff. I was always just spiraling, so I took it upon myself. I was like, look, I need to go talk to my doctor. I went to talk to my doctor, got on some medication, and that had helped me that helped me a lot. And, you know, just opening my mouth and really being an advocate for myself. I was like, look, I need something. Something's not right. I shouldn't feel this way. So that's what I did. And that, you know, I did that mid-semester, and it's been helping. And then, you know, but we also had a lot of good times. Me and my study group got even closer. You know, Wednesdays were, our Thursdays were our favorite days because we had class in the morning, and we had like an hour and a half of a break. And then we had class in the afternoon. So we had a tradition of going to Barbaritos and just having a good time and just laughing and joking. And it's really cool to kind of develop these really good relationships in nursing school, these friendships in nursing school. So we got to do that. We got to do lab together. We went to open lab together. We got to do IVs, and we got to, you know, clean our central lines and change these dressings, and all this. It's just a bunch of fun. You know, it's a lot of fun. After the stress is done, it's a lot of fun. And then you had CCEs on top of that. I didn't even mention that earlier. When you have all these classes, you have all this stuff, and then you have these exams, but also in lab you have CCEs, so you have to get checked off on all this stuff before you can even go to clinical, because you have to be able to perform these duties that you are learning, you know. So it was very difficult, but it was so much fun just going through the semester and learning who I was and how much I can handle, and knowing that I couldn't handle it all. Because I think that's something that I struggle with. Like, I want to be able to do it all. I want to be able to feel it all. I want to be able to make others feel better, you know. I have kids. I wanted to be super mom, super student, super this, super that, super, you know, child of God, and I just knew I couldn't do it all. So I just had to get some help, but it was a lot of fun. So second semester, I had some hardships, but I also had some celebratory moments, and it was really worth it. Second semester was a lot of fun. So this past semester, I also had a couple opportunities present themselves. So I let you guys know in my last video, I was voted to be class representative, so I'm still doing that. I started intern 1. I'm actually about to go into my nurse intern 2 program for this summer. It's for 7 weeks, but for my second semester, I got a job as a nurse intern 1, which I'm basically doing tech work, which is fine with me. You know, I'm caring for patients, changing, doing Foley care, peri-care. I'm giving baths, I'm changing linens. I'm helping feeding patients if they need help feeding, if they need, you know, if they need to be ambulated, I help ambulate with ambulation. I help go to the restroom. I change them up. You know, I already said I do Foley care, so all that. So it's really good basic work regarding patient interaction. It's a learning experience. I get to work with the nurses, and even though I don't work with them like I thought I was, but it's okay, whatever, it's a learning experience. I watch them, I talk to them, I ask questions, because they all know I'm in nursing school, so they're allowing me to be like, hey, can you we have a patient that's discharged and take their IV out, yada yada yada. So stuff like that. I can, you know, take an EKG, you know, all that fun stuff. Blood glucose, I get to take some blood glucose, I get to check the blood sugar, and then stuff like that. So, but it's a fun experience. So like I started working this past second semester, and then because the hospital here has like an internship program, and they have nurse intern 1, and then they have nurse intern 2. It's for 7 weeks, and I actually am about to go into that. I'm getting put on a step down ICU floor. I'll be starting that in a couple weeks, and that's for all the way until the end of June. Basically, it's just like a 7-week program. We get to shadow a nurse. I won't be doing any tech work. for the 7 weeks. I'll just be shadowing a nurse, and I'll be able to perform nursing duties as long as she's watching me. But I start that in a couple weeks. And then like the biggest thing of this past semester was I got voted to be president of the SNA of my program, and I'm very honored to be voted for that. I didn't really expect it, but at the same time I kind of did. But I'm gonna have fun with it. That's gonna be starting for this next school year. But I'm actually excited because we're gonna be getting together this summer and having like a bash together to kind of celebrate all the new officers that have come in and celebrate everybody, even the SNA students that kind of just graduated. We're all going to be getting together and having a little ball, like a little barbecue. I figured I was like, hey, do y'all want to get together this summer? Da, da, da. And they were like, yeah. And then, you know, we have a few things planned. Going to be attending like health fairs in the fall, and we're going to be doing like Christmas parades to get the word out there, because pre-nursing students can be part of it too, so that they can have an idea of what they're going to be getting into. But yeah, so I'm excited. I was very, very, very honored to be a part of that, and it don't hurt to go on my resume either. I'm just gonna say that. But no, but I'm excited because I'm like, this is a new opportunity, you know, it's fun. So yeah, so I'm like, well, thank you very much. So it's gonna be a lot of fun to kind of be a part of that as well. So third semester is about to be fun, y'all. Third semester is about to be like everything and then some. But yeah, so that's really like all the fun stuff for second semester that we've kind of went through and all that. So let's move on to the next category, which are tips for studying and how I studied this past semester. All right, so let's get serious now, right? Because now we're gonna get into tips. We're getting into tips, and probably you students who are watching who are about to go into your second semester to kind of get a gist of what you're gonna be going up against. How I studied. Okay, so I'm gonna break it down. I've tried a lot of study methods. I've tried active recall. I've tried rewriting my notes. I've tried note cards. I've tried it all, and actually a little bit of a combination of everything works for me, and I'll tell you now. My first couple of exams I did okay on, but I didn't do my best. Then when I started recording my lectures and re-listening to my lectures, I noticed my grades shot up and they stayed consistent. How I studied was I would always record my lectures, and I'm actually gonna put in a screen recording right here so I can show you like an example of what I'm talking about. All right, so I am gonna show you guys how I studied. So like I said, I would record my lectures, but as I was in class, what I would do, I would pull from whatever. So I would re-listen to my recording. It took me forever to figure this out, y'all. All this you see right here on the screen took me forever to figure this out. But anywho, I would re-listen to my recording again. I would add whatever else I needed to add on there, and then I would pull everything from there again and rewrite it again. And I would do that with like for instance with this, like we were going over oral and esophageal disorders. We were going over stuff like that, and I would like rewrite it. I'd add pictures so that I could have like an extra sensory thing, so like sometimes I can see it and remember it. So then if anything was important, I'd put that in red. If anything was like if anything was like a subcategory, I would or if it was like important information to know but not like dire, like boom boom boom, no, I would like highlight it with green. As you can see, like anything that was super important I did in red. That's what I would do. That is how I studied. The biggest tip was I would re-listen to my lecture. I would, you know, re-go over my PowerPoints. I would then rewrite them in like my own words, or take all the information that is core that I needed to know. And then if I didn't understand something, I'd go in the book. That's what I would do. I didn't read the book unless I absolutely had to, or if they pointed out certain pages to read from. that is when I read the book. Any charts or anything, that's when I would open that book. Other than that, I learned my lesson with that. I'm not going to be sitting here reading chapters upon chapters upon chapters. I just couldn't do it. I couldn't keep up with it. So that's pretty much how I studied. And then of course you had the homework questions that kind of went along with what we were learning about that week or whatever we were going over. And then we had like our sim labs or anything like that that kind of helped along with what we were going over. And then like we had stuff with practice questions and stuff like that. So, oh, that's another thing. Practice questions. Use practice questions. Like, use the programs that you have, your books that you have. If they have any questions at the end, or if they have like codes in there where you can get on and do practice questions, do practice questions. That's something that I always did. I always made sure I did practice questions because one, it helps you know how to test, right? It helps you to understand different questions and stuff like that. But two, if you pick the chapter that you're going on and or the body system that you're studying or whatever, you can get questions all regarding that information, so you can start to kind of practice your questions and know the information that you know, like, oh, I knew that, or I didn't know this, or I knew that. And read the rationales to everything. Even if you get the question right, read the rationale. That's something that I learned too. I always read the rationales because it's important information. You want to know why you got it wrong, but you also want to know why you got it right. What did you recognize from that question that you knew pointed you to the answer? So reading the rationale is important, whether you got it right or wrong. And then practice questions. So, and get some sleep. I don't know why people don't get some sleep. Sleep is important. Only sleep is for the dead. Well, I must be dead then because I'm going to sleep. I'm tired. If I got tired at my desk, I closed my book, I went to bed. Because I'm not retaining anything if I'm tired. If my eyes are closing and I'm re-listening to my lecture, I'm not going to hear nothing, and I'm going to have to go back anyway. So I just was like, I'm too tired for this. I closed my book, turned off everything, I went to sleep. So get some sleep and give yourself some grace. The second semester was a lot of fun, y'all. Second semester was a lot of fun, and I'm hoping third semester is gonna be more fun, and then we're gonna have fourth semester, which is final semester. But yeah, so I hope you guys enjoyed this video. I hope I gave you guys some information that you needed to know, was looking for. I hope you guys enjoyed watching and getting to kind of experience my semester with me through the screen, through the little lens right here. And yeah, so I hope you guys enjoyed this video. If you like to join, go ahead and hit that subscribe button down below. Leave some comments on how your second semester, if you're in nursing school, went, or what you're looking forward to, the classes you're taking for next semester, and all that fun stuff. So I'm gonna go ahead and hop off here so I can get this video edited because it's taking me forever to actually record it. And yeah, so I hope you guys enjoyed this video, and I'll see you guys in my next one. Bye.